I want to welcome everyone to the webinar tonight. This is part two of our sciatica and piriformis discussion, which is a huge problem with so many of us that may be abusive to their bodies. I work out every day, and I am guilty of not stretching and not doing the proper warming up before workouts all the time. So, you can have issues because of that, or maybe the occupation that you may have. You may do a lot of lifting, a lot of sitting, a lot of poor posture. But tonight we're going to talk about piriformis sciatica with Sandy Rose, who is one of our entrepreneurs here at Wakana. She is also a licensed massage therapist. I think a couple of months ago, it's not been a year, she said, you know what, I'm going to step out on faith and I am going to own my own business where I can really impact folks through massage, through holistic, natural ways of addressing conditions that cause pain. And there's so many conditions that cause pain. Lower back pain, like we talked about, nerve pain, sciatica, shoulder pain, knee pain. So we're going to have a discussion. And what I love about tonight is that tonight's going to be really short. It's going to be a really short presentation, but tonight we're going to do something different. We're going to, really break down and talk about each one of these products. And we're going to talk about our experience in the healthcare profession of dealing with folks who have symptoms that are associated with inflammation and how we use these products in that arena. Of course you are. You're right there. Can you hear us? You want to share your slide?
I can hear, but you're kind of lagging a little bit, but I'm keeping up still.
Okay, why don't you share your slides?
Okay, I will. Before I get started though, I want to say, Kathy, I'm so happy that we were able to figure out what was going on with your hip. I don't know if anybody saw, but Kathy said that from the information, she was able to figure out what was going on with her hip. So yay, I'm really happy about that. And that's one of the reasons why I love to talk about sciatica and piriformis, because a lot of times we'll think it's a pinched nerve, or we'll think it's some injury or something else going on, when really it's that itty bitty muscle in our buttocks that's really being a pain in the butt, and it's causing us a lot of problems. And it's kind of I won't say easy to get rid of, but it's easy to treat what's going on with the piriformis. So I'm going to leave sciatica to the side for tonight and just speak about the piriformis syndrome, because it is the muscle that actually causes sciatica. So I'm going to see if I can share my screen here with everybody and get this slideshow started. So bear with me just a second, and I'm going to see if I can bring these slides up for everybody. Let me know if you all can see it. Are you able to see my screen that says piriformis syndrome?
Did you hear the share screen, hit the share screen button?
I did. Let me back out and see if I could do it again.
Okay. Let me make you a co-host.
Okay.
That could be the issue. So I just made you a co-host. So now why don't you hit the share screen button? If you can do that. There you go. That was my fault.
Okay, perfect. As long as you're able to see it, I will start the show. All right. Are you able to see that?
Yes, beautiful. Perfect. I love that image. Oh my God, that's how I feel most days.
Yes,
that's exactly where it hurts.
That's exactly where it hurts, and that's exactly where it travels. So it starts right up there at the top of your glutes, at your butt at the top, almost in your hip. And if it becomes chronic, it's going to start creeping all the way down your leg. It's going to stop there at your thighs. It's going to hit your knees. Sometimes it'll make you feel like you're having knee issues. It'll go all the way down to your ankle. And that's how you know that it's becoming chronic. All right, so just to mention it, piriformis syndrome is a condition in which the piriformis muscle, very small muscle, is located in the buttock region. It spasms and it causes buttock pain. The piriformis muscle can also irritate the nearby sciatic nerve and cause pain, numbness, and tingling along the back of the leg all the way down into the foot, emulating the sciatic pain. The pain from piriformis syndrome can go away on its own. However, if it becomes chronic, there are stretches and exercises that you can do to alleviate the pain and symptoms. And I'm actually going to show a few very simple stretches that you can do to try to alleviate this pain once you start having it. So the first one is a very easy one. You can do it in the bed. As a matter of fact, I started doing it in the bed because it was just sometimes too painful to lay on that hard floor. So you basically lay down on your back, put one foot up, whichever side you're not stretching at the time, and then just cross your leg over. For this very simple figure 4 stretch, if you're having a lot of pain, just simply doing that pose right there will start to alleviate some of that pain. Once you start to alleviate that pain, if you want to go into a slightly deeper stretch, that's when you can stay in that motion, grab that leg where the foot was flat on the bed or on the floor, and literally pull back on it. What I was doing when I started doing this particular stretch, the way that I knew that this piriformis issue was getting better is because every week I would pull back just a little further. It would cause a little more pain, but you're getting a deeper stretch. Every time you do that, every week, just pull back a little further, and it stretches that muscle out a little more, gets that blood circulating in a little more, alleviating and reducing that pain. The next stretch, which is the same exact stretch, except this time you're sitting in a chair. So if you're at work, a lot of us work from home right now, you know, and we're having a hard time getting up. You know, if you start to feel this pain, or even before you start to feel the pain, do the same thing. Cross one leg over and just bend forward. The further you can bend over, the bigger the stretch is for you, the better the circulation is with that blood getting into that region, again, alleviating the pain. This next one, kind of the same thing. I think some of us yoga heads, people that go to yoga, call it, is it like the hugging the baby, or I don't really know the term for it, but you're laying on your back, bring both legs in, and then just simply hold. Sometimes if you're having a lot of pain, you can rock side to side, or you can just do a static stretch, which is like counting to 20, 30 seconds, letting that leg go and doing it again. I do it about 5 times, you know, just to get the blood circulating in that area. And piriformis syndrome also responds well to exercise. Keeping your glutes and legs strong is the best way to prevent pain from your piriformis. As Dr. Rita was mentioning, she's into working out a lot, and I am too these days. I don't have pain any longer because I started the stretching. I started on therapy and all of that maybe a year ago, and now I'm just in the prevention or the maintenance stage to make sure that that pain just does not come back. Again, piriformis is a muscle. Regular strength training is best for it once you get rid of that pain. And I know I kind of went quickly in there. Like I mentioned, it was going to be short, but I just really had to show these 2 topicals because I use them every single day on my clients that have this piriformis and this sciatica issue. And I wanted to show these 2 separately. The 500 there on the right, I use that one because that is the one that has the, and I'm going to look because I want to make sure that I'm saying the right thing. That's the one that has more of the camphor in it, the organic peppermint, and the eucalyptus. And with those three ingredients combined, you can get a much deeper penetration into your muscles. That starts to relax that piriformis syndrome. If you're a massage therapist, it starts to relax it for you, making your job a little easier. You can get in there now and you can massage that person if that's what you're doing. If you're the person with piriformis syndrome, putting this on before you start your stretch, maybe 30 minutes or so, will help to relax that piriformis muscle, help you get a deeper stretch, get that blood circulating in, and it's just much easier and a quicker relief for you. The 400 on the left-hand side that says the Power Pain Cream, I use that one after. I may even tell a person, I send them home with it and I have them use it before bed, because it is the one that's going to get deep down in there and help to now start to relieve the actual pain. So the 500 is going to relax that muscle. The 400 is going to get in there because of the ingredients that's involved. It's going to start to relieve that pain just a little more, get you a good night's sleep, get you back into the gym exercising if you use that before, or if you use it when it's time to go to bed. And that's what I have on the Piriformis for tonight.
Thank you so much.
You're welcome.
You want to stop sharing so
Mhm.
we can
There you go.
look at our other products? And, you know, you'll have to excuse me because there may be a delay because of my internet. But let's talk about Dr. Rita's Rub. Dr. Rita's Rub is a product that I like to use before my workouts. And what I love about working with Cassandra or Sandy Rose is that she's absolutely right. We have 3 topical products, and all 3 topical products are amazing, right? Theoretically, when you think about it, just think about it theoretically. A 500 milligrams is more than 400 milligrams, which is more than 200 milligrams. So theoretically, you would say, hey, the 500 milligrams has to work better than the 400 milligrams or the 200 milligrams. But when you think about the way that we formulated these products, we formulated these products with additional essential oils that address inflammation, that address really the culprit of pain, and that's inflammation. So theoretically, Dr. Rita's Rub, which has 19 to 20 essential oils, could potentially work better for you or your client that has severe conditions that cause pain, like osteoarthritis or rheumatoid arthritis or lupus. My recommendation, personally, and from patients that I've recommended these products for, is to try all 3. You know, it's almost when you talk about, you know, having a headache. When I have a headache, I only need it in the past, before I knew about CBD, I only needed 1 Tylenol. Whereas Sandra, she told me she needed 2 Tylenols. So it really depends on your body, how your body metabolizes CBD, the condition, the severity. But we do know that because of the menthol that is in this 500, oh my gosh, the menthol addition with the CBD and the other 5 essential oils, it gives it that cooling, relaxing sort of feeling to the muscle, right? And then when we look at the 400, which has 8 certified organic oils with the CBD, it gets deep. It has an ability to really penetrate. And absolutely, I see the same thing with my patients and even myself. I use this at night when I'm sleeping. And then the Dr. Rita's Rub I use during my workout. I just feel like this is a product that works quickly when I'm moving the muscle, when I am in my exercise class. For me, this works the best. So again, you'll say, but Dr. Rita, you didn't answer my question. Which one is best? It depends on so many factors that absolutely trying all three and working out which one is best as it relates to different scenarios. It's like, do you like McDonald's or Burger King? Do you like White Castles or Wendy's? I don't know. You know, different preferences for different people. But personally, Dr. Rita uses all three, and I use all three at different times. I use the 500 after my workout, that cooling, bio-freeze sort of feeling. I use the Dr. Rita's rub during my workout, and I use the 400 when I'm sleeping. Sandra, you want to add anything to that?
I do. Um,
Okay.
what I wanted to add was the milligrams. Don't really let the milligrams fool you, because as Dr. Rita stated, it just depends on what's going on with you and the time. I like to tag team them with my clients, because I know the one with the menthol in it is going to give them a certain relaxing feel. The smell from it helps a lot when I'm massaging. That smell actually comes in first before they even feel the sensation, and then the relaxation comes in, and then I can piggyback and use the extreme pain. And how I found that out was just simply trial and error from, you know, myself and from people letting me know, hey, when you use that 500, it relieved a lot of the pain. When you use, well, it relaxed me. And when you use the 400, it relieved the pain. Why is that when that was 4 and that was 5? Again, it's just because of the ingredients that's in it. And that menthol goes a long way with helping you to relax that muscle. Yeah.
Absolutely.
Yes.
So now, Sandra, let's move on to our tinctures.
Okay.
Our tinctures are the oils that you put underneath your tongue. Again, when you are dealing with symptoms due to conditions that cause pain, it's really important to use all methods of consumption of CBD, right? A topical is just not going to do it alone. So our tinctures, we have our Hempranium MD, we have our Power Hempranium 500, we have our Culinary 500. We also have a pure product as well. Our pure product is going to be for those who have random drug screens. That's a white label. And then the power products, again, they have black labels. Same thing holds true. If you're dealing with someone that has limited mobility, they're walking with a cane or a walker, they can barely get out of bed, they may have multiple sclerosis and really have issues, and they're pretty much bedridden. Well, that's a person that you want to recommend the Hempranium MD. The Hempranium MD is our strongest, highest potency CBD tincture that we offer. Everyone else who has mild to moderate conditions can do the Hempranium 500. Now, what I've noticed is that there are some people who have sensitivity or food allergy or food sensitivity to turmeric or maybe black seed. And so they would want to use the Culinary Plus, because the Culinary Plus does not have those additional essential oils like the Hempranium 500. Start low and start slow. I don't care if the person has pain that's a 10 out of 10. Always start low and slow. 3 drops in the morning, 3 drops in the evening. Let the customer, your family, your patient know that we can always increase the CBD, but starting at high doses immediately is something that I don't advocate, because if you give someone too much CBD initially, too quickly, too fast, they will have an unwanted side effect. They may be nauseated, or that may cause excessive fatigue. We want them to have a good experience. So start low, start slow, making sure that you are recommending a topical, along with one of the tinctures, okay? As we move on to our gummies, right? I'm a big, huge advocate for if someone has a condition that they want to address in a holistic way, I don't personally recommend one product. I recommend all our products, right? Because we understand that each product has a different duration in our body. So as one is working and one wears off, the other one can kick in, right? We know that when you put a topical on someone, it works pretty fast. Within 5 to 15 minutes, they start feeling some sort of relief. A tincture takes about 20 to 30 minutes to get into the bloodstream, right? But it will last for about 6 to 8 hours. Whereas topicals, for me, they wear off in about 2 to 3 hours. So again, as one is working, the other one stops working, this other one kicks in. So let's talk about the gummies. The gummies are something that I use every single night. I like using gummies at night because as I am sleeping, I want to address inflammation and I want to address a restful night's sleep. So we have two products. We have our Power. That is the product that contains the legal limit of THC, and then the Pure. Again, whenever you see a white label, those are products for those who have random drug screens at their job. We want everyone to keep their job, so you'll recommend to them our Pure products. You can also recommend to them our topical products, because topical products do not pass in the urine, they don't pass in the blood-brain barrier. So even though someone wants to use our products and they have random drug screens, yes, you can recommend a topical, you can recommend a tincture, and you can recommend a gummy. That's 3 products right out the door that they should be using. Now, gummies can also be taken during the day. I love using the Pure gummies during the day. Why? Because the Pure gummies have less than 0.0% or less of THC, and it doesn't give me the drowsiness like the Power. So I always have both of these on hand in my home, in my purse, at the hospital. I'm at the hospital here. You see, I've got my products on hand to address certain issues with anxiety, issues with inflammation and pain, headache, toothache, you name it. I've not taken Tylenol or Motrin or Aleve since Melissa Boston introduced me to CBD. And that was in 2017. I've not taken any over-the-counter medication. And that's something you really seriously should educate your family and your friends, your customers, your clients. Non-steroidal anti-inflammatory drugs like Motrin, Aleve, even acetaminophen, Tylenol, long-term use can cause kidney failure, can cause liver failure, can cause stroke, can cause GI bleeds. So just because it's over the counter doesn't mean it can have, it won't have potentially devastating results on your body long term. So again, millions of Americans have pain, chronic pain, acute pain. Let's help them with that by recommending, our products that are organic and holistic. I'm going to say one last thing because I've not let Sandy Rose talk. I'm going to bring her back up, but I just want to get out of the way our smokable products. We have flour, we have cartridges, and we have a pre-roll. Now, personally, Dr. Rita loves the hypnotic cartridge. I love it. Why? Because I love peppermint. Anything that gives or has peppermint in it, I love, because peppermint gives me that that uplift, that energy, as well as the smokable products will get into the system within 1 to 5 minutes. So yes, I taught kickboxing this morning. So you know I was hook, hook, shoulder, discomfort. So 1 to 3 pulls on this, 2 to 3 times during the day, you know, rubbing this on during the kickboxing class. I did my tinctures this morning. I'm good. I'm good. So the smokable products have THC in them. So they cannot be used by someone who has issues with pain, inflammation, right? They cannot. What they can use is our broad spectrum gummies, our pure tincture, and any 1 or 3 of the topicals. But these smokable products are amazing. They are great for acute onset of discomfort, acute onset of anxiety, anything that causes acute conditions or issues. You want to make sure that you have one of these on hand. I keep this with me at all times. So that's what I want to say. Sandra Rose,
Yes, ma'am.
do you want to add?
Um, the only thing that I would like to, the only thing that I would like to add is that I'm a huge muscle nerd. And it's just that simple. I'm a huge muscle nerd. Been with the Wakana for almost 90 days now. I'll be entering my 90 days towards the end of this month. Yay. And
Congratulations.
thank you. The reason I got involved is because I'm a health advocate. I want to see everybody healthy holistically. I'm not big into medication, even though, of course, if you're prescribed something and you truly need it, of course, listen to everything that your doctor says. But I'm into being holistic. I'm into prevention. I'm into exercising, stretching, all the wonderful things that I can offer this one body that I have. And I just want to share that information with everybody. I cannot stress enough that, especially if you're over 40, as I mentioned the last time, every 10 years, you're going to lose 5% of your muscle mass if you are not working out. By the time you're 80, you have lost 50% of your muscle mass that you're not going to get back, which is why a lot of older people fall and, have bone breaks and other issues. And a lot of that is preventable, even if after the age of 40, you start strength training, working out right now. And we are ahead of, or have a little more information than a lot of society have, using Wakana's products and CBD, the tinctures, the gummies, and everything to help prevent pain, to help maintain that wonderful system that we have inside of us naturally. So get out there, all of this wonderful stuff that's going on in this country right now is starting to subside. Get out there, get back into the gym, get into your basement, get into your living room. I don't care where you go, just get those muscles moving. And when that pain starts, grab these wonderful products and start using them in conjunction, and just have a healthy life. And yeah, that's all I want to add. Work those muscles because they are so important to us. I am a huge muscle nerd.
Well, thank you so much. Thank you so much for that information. If you could put in the chat, if you're a guest on the line, I'd like to know how many guests we have on the line. And if you are a guest, can you just put in the chat box who invited you? You can also put in the chat box, if you're on the line, a business partner or a guest, you can put some questions there for myself, for Sandy. Our medical advisory board is on the line. Their panelist, Dr. Rashonda Conte. She is our clinical psychologist. She is a specialist in addiction medicine, Dr. Herman Glass, he is our chiropractor. We have Dr. Betty Smith, our naturopath. Dr. Tyus Crawford is our family practitioner. Dr. Joyce Smith is our pharmacist, and Erica Zachary is our licensed clinical social worker. And then Kathy Weathersby is by trade, a microbiologist as well. So thank you for being on the panel. If any of our panelists would like to add any information that relates to their experience with these amazing products as it relates to pain, inflammation, or the topic we're talking about this evening.
Dr. Rita, if I could, I'd love to share a recent experience that I just had with one of my clients. So thank you, Sandy, for that awesome information about the back, because we know that we hear that so much from so many people. So as Dr. Rita shared, I'm a psychologist and I work with persons who are primarily heroin and cocaine dependent. I had a client, today is Wednesday. So I had a client over the weekend who was actively using heroin and was going through a very intense moment because he wanted to use more. And his significant other obviously did not want that to happen. And she was adamantly trying to find a way to give him some assistance. But because of the withdrawal that he was feeling, most of his pain, and we know that muscle pain is very much one of the symptoms of opiate withdrawal, and he was experiencing it in the lower part of his back, and that's where most of the pain was settling. And so she's freaking out, and I'm talking with her, and he wants to go get heroin. I'm telling him, no, that's not the answer. There is definitely an alternative. And I was able to get to her, and immediately I put your Dr. Rita's rub on his back. In addition to that, I immediately popped some power gummy into his mouth. Put the Dr. Rita's rub on his back, and in addition to that, used the extreme relief. When I got to them, he couldn't talk. I was giving him a lecture, and he's like, Dr. Conti, not today. I can't have that right now. He was just in so much distress. Well, within and I say 10 minutes, okay? I'm saying 10 minutes. But his significant other said, no, Dr. Conti, that happened in 5 minutes, but we're going to push it and say 10 minutes. In 10 minutes, he was talking to me, smiling, laughing, telling me, he said, hey, Dr. Conti, you really got something here. You really got something here. And he just kept saying that because he could not believe the intense pain that he was feeling, that all of a sudden that pain was gone. And so I just want to attest to that Dr. Rita's rub and the ointment, the cream, and those gummies was amazing. And so while talking to him, one of his friends called because they were concerned. And unfortunately, it was a friend of his who is going through addiction as well. He called back, and so my client's significant other answered the phone, and I said, look, you don't have time to take a call right now. But she put him on the phone anyway, and he's talking to her, to this guy on the phone, and he says, hey, listen, I'm gonna have to call you back because Dr. Conti's performing surgery on me right now. So I'm gonna have to call you back. And so the guy's like, hey, is it working? And he said, yeah, it's really working. Like, I feel so much better. And the guy's like, okay, well, call me back because I may need some of that assistance too. So I'm just saying that these products not only work, but the quality of them make them work so much faster that people are able to get relief very, very fast. And so that just happened just a couple of days ago, and I'm just so happy that I was able to be of assistance to a client who was in that type of acute distress.
Wow, I love that. You know, you never think about those who are going through withdrawal that have those issues that affect the musculoskeletal system.
Yes.
Very, very important. Very important. So all of you out there that know people that have addiction issues, absolutely these products can work not only for their withdrawal symptoms, their anxiety, their pain, their sleep. We can assist with all of that. Thank you for that share. Thank you.
Absolutely.
Wow.
Absolutely.
Thank you for operating on him.
Right. I became a surgeon that day.
Thank you for that share. Any other questions or shares that anyone, our guest, our panelist, or our business partners?
Hi, Dr. Rita. This is Eric. I have a couple things I can share. So one, I don't know if my, can you hear me?
Yep. We can.
Yes, I can.
Okay. So a couple things. So one is just as she was talking, I was just remembering too that I don't know if my new business partner is on, and I won't call her out, but she'll know who I'm talking about. If she is, she can decide to disclose if she wants to. But so I had her, she just started in a business like 2 weeks ago, and she has a couple of autoimmune conditions going on, some that cause pain. And so she called me a day or two, I'm losing track of my days with everything going on, but a day or two ago. And she was like, these products are really working. This is the first time I've been able to get down on the floor and clean my bathroom in months. She was not able to do it because of all the pain that she's been in. So she had been taking she just got her packet, her dispensary, and she took the Power 500 and gummies, and she's like, wow, it really helped her in regards to her pain, and she's much more functional. And then she called me today and she told me she was at the bank, she had some incident, she's trying to get the money together for her shares, and something happened at the bank and it wasn't working out for her. She's like, Erica, I would have exploded on that woman. And I was so calm. I surprised myself. I was so calm. And so I was just happy to hear her say that. But I've known her for longer than my daughter has been on this earth. And so just really happy to see her getting relief from her symptoms.
Wow.
So that's one thing. And then I'll just, as you were talking about the Pure gummies, I take the Pure gummies all the time. If I'm not with those gummies, we not having a good day. I take the Power at night to help me sleep. I take that and magnesium at night. I have MS. I've had it for 22 years. I've chosen to manage it naturally. And so I've never taken any disease modifying drugs. So I usually take the Pure gummies during the day because it just helps to relax those muscles. It doesn't make me sleepy so much. I take those in the Power at night, but the Pure will help to relax me so that I'm able to just not feel so tensed up and so stressed. Today has been a stressful day, not related so much to the MS per se, but with the whole election thing going on. So I've been using my vape today and taking gummies today. I'm going to need a new bottle. Taking gummies because it just helps her to reduce, because I have clients, I'm a mental health therapist, and I had clients I needed to see. So I can't be all stressed out while I'm hearing all of what's happening with them. I need to be calm. And so, so I was using my hypnotic. And so I'm one of those people. I use CBD all day. I use water soluble. I get up in the morning, I take the Power MD. I use the water soluble in my water all day. I add the seasonings in. My favorite is the garlic fire, but today I was using Flavor King in my salad. And so I just layer it. As you were talking about layering, it's been really important to me, and I noticed the difference. So that's all I wanted to say.
Thank you, Erica, for that share. I would have to say that I, like you, have been using CBD for the last 3 years, and I use it all day.
Yep.
I use my vape, my Power gummies during the day,
Yep.
my water soluble, my water when I'm working out. Yeah, just
They're right by.
love the product. So
Close. I keep them close.
yeah, so it's really, yeah, um, such a powerful share all the time. You know, we hear from people that are part of Wakana that have issues and challenges like Erica, multiple sclerosis, you know, really being able to manage that in a organic, holistic fashion. But also knowing Erica's very, very, very up on her exercise, you
Yes.
know, lifestyle modifications, her water, her sleep, her exercise. You know, it's all magical when you put it all together with CBD.
Yep.
We can't make claims, and we certainly, absolutely should never give the client, our customer, our family, the assumption that if they put this under their tongue, their pain will go away, or their anxiety will go away, or their sleep like a baby. There's so many things that have to be added to the CBD. Healthy, active lifestyles, right? So
Yep.
really important. There
I
is
can
someone
add, I'm
that,
sorry, Dr. Rita. I will add, I'm sorry to interrupt you, but I just thought about it. So thank you, Sandy, for your presentation, because it also helped me to recognize that a lot of the things that I'm doing with the MS Gym, with our exercises, and that piriformis muscle is often that pain in the butt that a lot of us with MS suffer with. So we're doing a lot of those exercises, and you added some that I can try out myself. But that was very helpful. So it just validated that we're doing a lot of the right things. And so I thank you for your webinar.
yeah, that was so helpful. I'm here in the conference room doing my little leg over my knee stretching, sitting, kind of bending over, because I'm telling you, I'm guilty of not making sure that those muscles are adequately stretched before I work out. So it was very, very informative and very, very helpful, Sandy. And hopefully all of you on the line took notes about those additional exercises that she shared. And this is a recorded webinar, so you can always come back and refresh that knowledge. Any other questions, comments before we close it out?
Yes, this is Dr. Glass in Detroit.
Dr. Glass in Detroit, we
Yes.
are so excited to have you.
I'd like to commend the massage therapist on her presentation. Very, very nice. I've been in practice 38 years and incorporate massage therapy into my practice. I would like to comment on Dr. Rita's rub because it's oil-based. I think it works better than the creams, but also you can use in conjunction with the creams. But I love using Dr. Rita's rub on the patients who have MS and sciatic neuritis and other neuromusculoskeletal problems. Just wanted to comment on how well it's doing.
Oh, that's so good to hear. And I'm glad you made that comment, because I am a big advocate of combining the oil and the salve or the cream. Dr. Conte talked about how she did that. And a lot of people do and find it as very helpful as well. So you can do that. You can take the Dr. Rita's rub, combine it with the 500 or the 400, just very, very, very good products that you can really work with and find your sweet spot. Figure out, you know, which one is the right one for you. Any other questions? Thank you, Dr. Glass. We are so honored by your presence. We want to see more of you. Dr.
Okay.
Glass, he owes me a webinar, a chiropractor webinar. Yeah.
Okay.
Well, if I can quickly, Dr. Glass, you will be proud to know that when I see my clients and I notice one leg is shorter than the other, or the hips are a little funny, before I even start with my piriformis syndrome spill or my sciatica spill, I send them to their chiropractor. Then
Yeah,
I say,
we work in,
come back to me.
Yes, we work in conjunction very well, and I commend you on that presentation. Very professional and very nice.
Thank you. Thank you. And just to let you know, I'm a Michigan native, 45 minutes from you up in Flint. So
Oh, you're as we affectionately call a Flintstone.
yes.
Well, thank you,
Dr. Rita.
everyone. I am so excited that we were able to really discuss a very important topic in our products and how we are able to use them in our loved ones, in our patients, and our clients. If there's not anything else, we will say good night. We'll see all of you in the morning, and we will see all of you on all of the calls next week as well. Have a safe and a very prosperous evening. We only have one patient who is getting ripened right now with Cervidil, so there's not much excitement going on upstairs. And I'm happy about that because I need to get a lot of work done, right? We've got a lot of founders packages to move around between now and certainly the end of this month. So have a good night. We'll see you all. Thank you again. Sandy Rose, you are amazing.
Yes.
And thank you, Wakana Advisory Medical Board, for being on the panel. You guys are amazing as well. And thank you, business partners and guests. You guys are amazing as well. So have a good night.